Hey, well, good morning, ma'am. My name is Janelle. I heard that you're here because you have an injury?
Good morning. Yes, I was going through all these old papers in my attic and I cut myself.
Oh,
My husband thought I should probably come in and see if my tetanus is up to date.
very good idea. Well, I can find that out for you. First, though, I would like to take a look at this paper cut and see what we need to do with that.
Okay.
Let's see.
No, not there. Right here.
What the health? Welcome to another episode of What the Health. Today we're going to be talking about tetanus, or you may have heard the other name for this, lockjaw. So tetanus is caused by an anaerobe bacterium called Clostridium tetani. It is found in the soil, and it's also found in some mammals in the gut lining. The spores from this anaerobic bacterium can travel in dust and can land on objects that are in our environment. They look for places that have low oxygen, dead tissue, a perfect environment for this spores to develop and cause the tetanus infection. So, for example, in our patient that we saw today, she developed a paper cut. That's not very likely to cause tetanus, but when those papers are up in her attic, they've been covered with dust, and if the cut is very deep, that can create the environment that could cause her to get tetanus. When we think about tetanus being on objects like a rusty nail or on a knife, tetanus doesn't actually live there, but the spores can be in the dust that has landed on those objects. And so most commonly, we would see this develop with a puncture wound. So when tetanus gains access to the perfect environment, the spores create an endotoxin and tetanus can develop. So the endotoxin from tetanus affects the nervous system of the body. This can cause symptoms such as muscle clenching, tightening, and spasms, hence the name lockjaw. It can make the abdominal muscles very tense, the back to go rigid, the fist to clench very tightly. It can be life-threatening because that can cause the muscles of the chest not to be able to breathe anymore. So we don't ever want tetanus to get that far. So how do we prevent tetanus from happening? Well, immunization. So beginning all the way down at the age of 2 months, our primary vaccine series start treating us with a vaccine to prevent tetanus at 2 months, and you get a series of 5 vaccines up until the age between 4 and 6 years old. Then, between the age of 11 and 12, you get another booster shot for tetanus, and then 10 years later, you should get another booster. And you should continue to get a booster every 10 years for tetanus. Certainly, if there's an injury in between, it should be looked at to see when you've had your last tetanus. Now, another age group that's very common to have their tetanus booster done would be during pregnancy. And that is very protective during childbirth then for the mother and for the baby. What other things can be done to prevent you from getting tetanus? Well, if you would develop a puncture wound, you should clean that wound very well. Now there is a myth that, well, if the wound has bled quite a bit, that's cleaning it itself and you won't get tetanus. Nope, that's not true. Even if it's an animal bite, that penetrating wound such as that, you still could get tetanus from that because of the mouth of the animal, from the environmental factors that get put into that deep penetrating wound. So let's say that you get a wound and you haven't been updated with your tetanus. The incubation period for tetanus to develop is about 3 to 21 days. So if you have a wound, you should go and find out when your tetanus status was if you don't know it. And that can be brought up to date even after the wound or injury has happened. Now, I have seen patients before who have gotten a wound or a bite from an animal, for example, veterinarians, and they know that the animal has had tetanus. So there's been an actual exposure. And in cases like that, an immunoglobulin can be given to help to try to prevent from getting the tetanus. If somebody does actively get tetanus and they've not been vaccinated, there is treatment for that as well, but it is a life-threatening condition, and so really prevention is, again, the best medicine. Thank you for joining me for another episode of What the Health. If you have other topics or questions at all, please contact me here at your Hawkeye Student Health Clinic.